Not into long podcasts? Don't worry, we've got bite sized clips just for you. This is CWN Clips. Please don't forget to subscribe. I think you're bringing up a very important point for the young generations or even parents or any people to know that the idea in general is actually your health is determined by DNA, but not just for Parkinson's, but in general for most of the diseases. We just tend to say that's a lethargic attitude I've seen with people that, hey, my parent had it, so I'm going to have it. But as an individual and as a society, what are we doing to actually take precautions to actually not get that, even though if it's hereditary? Some of them you couldn't avoid, but as a lifestyle, as a food, the way of living, I think it's a very important point you're making. And I think what I see is 87% of people with PD have no known genetic cause or risk factor for the most crucial statistics supporting.
Yeah, so let's talk about genetics. Genetics are important in health. About 30% of health is explained
Right.
by genetics, heritable factors. For the first 10 years of my academic career, I focused on a rare genetic disorder called Huntington's disease, which is purely genetic. If you carry the mutation in a gene called Huntington, you develop Huntington's disease. If you don't carry that genetic mutation, you don't get the disease. So there are important genetic causes, but not surprisingly, these genetic causes explain either rare diseases. They can either be common causes of rare diseases, or they can be rare causes of common diseases.
Yeah.
But it's really hard to imagine having common genetic causes of common diseases. If you look at the heritability of different diseases, some are very heritable. Type 1 diabetes, schizophrenia. But the bottom of the list are diseases that are common, like Parkinson's disease, like breast cancer. If you look at the rise of type 2 diabetes, if you look at the rise in obesity, if you look at the rise in autism, if you look at the rise in ALS, these things are not being driven in all likelihood by changes in our genes. These are being driven by changes in our environment and changes in our behavior. So you alluded to two landmark genetic studies, both published in one of the leading neurology journals called Brain last year in 2024.
24, yeah.
One led by the Parkinson's Foundation, offered free genetic counseling and genetic testing to anyone with Parkinson's disease in the United States and in other countries. And they looked at the results from the first 8,000 individuals. For 8,000 individuals, they looked and they identified a genetic cause or risk factor in 13% of individuals with the disease. Said another way, 87% of Americans, the vast majority of Americans with Parkinson's disease, carry no known genetic cause or genetic risk factor for the disease. Two possible explanations. One, my outstanding colleagues, Dr. Andy Singleton, Dr. Christine Klein, and others who are outstanding geneticists, they've missed. I don't think that's the case. There have been about 35,000 publications on the genetics of Parkinson's disease. I don't think we've missed the most common ones. Second explanation is that the principal causes of Parkinson's disease do not lie within us. They're not in our genes. They are outside of us in our environment. And this is consistent with what we've known for over 100 years. In the late 1800s, Sir William Gowers, a prominent British neurologist, said that only about 15% of my patients with Parkinson's have a family history of the disease. And indeed, numerous studies since that time have demonstrated that between 15 and 20% of individuals with Parkinson's have a family history. Said another way, the vast majority, 80% of people with Parkinson's, have no known history of the disease. And if you look at the most prominent individuals with Parkinson's disease, Michael J. Fox, Brian, the former NBA basketball player,
Right.
Brian Grant, the Olympian cyclist and Tour de France winner Davis Finney, Larry Gifford, the founder of the PD Avengers, Ali Signorelli, a powerful voice for Parkinson's disease, Dr. Sarah Winningham, who served in the Air Force became a physician, served in her country in Afghanistan, and then developed Parkinson's disease in her 40s as the subject of our introduction. All
Yes.
these individuals, none of them have a family history of the disease. None, to my knowledge, carry any genetic risk factor for the disease, and all of them were young. So these are all individuals I just named who are the faces of Parkinson's disease with young onset, age of onset before age 50, no family history of the disease, do not carry the genetic risk factor for the disease. If we find out what the causes of Parkinson's disease are for these individuals, we can, prevent the disease by preventing exposure to future generations. Two, give opportunities for them to slow the rate of progression by stopping their exposure. Three, come up with more powerful treatments and even cures for the disease. If we want to cure Parkinson's, which we want to do, the prerequisite to curing a disease is identifying its cause.
Right.
It's really hard. In fact, I can't think of a single medical condition that we can cure where we don't know its cause.
Yeah.
We can cure hepatitis C with a pill because we figured out what causes hepatitis C. We can cure
Malaria,
peptic ulcer,
polio.
polio. All these things we can cure once we know its cause. Let's identify the causes of Parkinson's disease, so we can prevent them, slow it, treat it, and cure it.
This is just a glimpse of one of the many conversations we've had in this channel. If you found this thought provoking, please don't forget to subscribe and explore more insights from unfiltered voices and the real world experts. And please don't forget to like and share this video to as many people as possible. It keeps us going. See you in the next one.